The American taxpayer is under attack. And the enemy is stealing billions of dollars meant for seniors and the vulnerable right out of our healthcare system. Welcome to the Deep Dive. Today we are jumping into a really historic Department of Justice operation. It exposed what officials are calling an industrial scale and a truly global scheme.
A scheme aimed at just draining federal health programs.
Yeah.
Medicare, Medicaid.
Exactly.
And the scale of this financial war, it's difficult to fully comprehend. The intended loss uncovered in just this one single takedown was north of $14.6 billion.
Billion, with a B.
With a B. And we're talking about 324 defendants charged across the country. But here's the part that is really disturbing. 96 of those people were licensed medical professionals.
So an inside job.
A massive internal threat.
And our sources confirm the core idea here. This isn't just random crime. These are highly organized, very sophisticated syndicates. Many of them are actually operating from foreign countries. And they've just systematically exploited weak government oversight. I mean, they treat the American healthcare system, which handles something like, what, $1.7 trillion a year?
Trillion, yes.
They treat it like their personal piggy bank.
So our mission today is to, unpack these just astonishing numbers. We want to reveal the sheer audacity of these schemes and then really explore the new strategies that law enforcement is using.
Right, because the strategy is shifting.
It's a fundamental shift. They're moving away from that old pay-and-chase model, which is trying to claw back money that's already stolen, probably already offshore.
Which almost never works.
It rarely works. Now, the goal is crushing the fraud before it ever leaves the bank account. We want you to see exactly how your taxpayer dollars are being protected and where they still remain dangerously exposed.
Okay, let's unpack that. The ease with which these criminals got into this system is, frankly, it's shocking.
It is.
The main vulnerability was just getting a hold of identifier numbers from seniors and Medicaid recipients. That was the key to the whole kingdom.
And we really have to counter this myth that healthcare fraud is some kind of victimless crime. It is anything but.
Right.
Every single dollar that's stolen means higher medical costs for everyone. And it strips resources from the very people, the sick, the elderly, who really rely on these programs for their survival. The sophistication is high, but the impact, it's painfully real.
And when you look at the specific schemes, the audacity is just, it's almost laughable. If it weren't so tragic, we found examples of completely impossible billing that just went totally unchecked.
Yeah, that really shows the lack of scrutiny. Think about this for a second. Law enforcement found claims from a cardiologist, who was billing Medicare for in-person services in Georgia and Nevada.
At the same time.
On the same exact day. So unless they've invented some kind of high-speed teleporter that we don't know about, that should be an immediate, massive red flag.
It just shows you how confident they were that nobody was watching.
Absolutely. We also saw this really bizarre mismatched billing, like mental health clinics, places that do counseling, right?
Therapy, talk therapy.
Yes. They were trying to bill for skin substitute placement. That's a surgical procedure. And they claimed it was performed by an anesthesiologist. The combination is just medically absurd, but the systems were just set to auto-pay.
And here's where it gets really dark. It goes beyond just financial theft. The criminal activity, it directly fuels the deadly opioid crisis that is just devastating communities all over the country.
That direct link is so important. In this one takedown, 74 defendants were charged specifically for their role in the opioid epidemic. This included doctors and pharmacists.
People we're supposed to trust.
People who were actively and intentionally trading prescriptions for cash. It's a complete betrayal of their oath. The numbers show you just how deep this goes. This one effort uncovered the illegal diversion of over 15 million controlled substance pills.
15 million.
Oxycodone, hydrocodone, just pushed right onto American streets.
So law enforcement is finally starting to treat them like what they are?
Yes. They're rightly cutting through that veneer of medical respectability. They're vowing to prosecute these professionals as drug dealers, and the evidence, well, it supports that. They use their license to make money off addiction. They need to face serious consequences.
So if we follow the money, the scale of this means American taxpayer dollars are just being laundered and shipped overseas at an absolutely alarming rate. This isn't a local issue.
Not at all. It's a global threat operating right here on American soil. That's the really disturbing trend. These transnational criminal organizations, and sources are specific here, they name groups from Russia, Eastern Europe, Pakistan.
And they've just realized that our healthcare system is an easy target.
It's low risk and incredibly high reward, especially compared to, traditional drug trafficking or smuggling.
So if these groups are based overseas, how are they doing this? How do they buy up American companies and bill billions while staying hidden?
It's a very sophisticated shell game. There's one operation, they called it Operation Gold Rush, that was run from Russia and Eastern Europe. It strategically purchased dozens of existing U.S. medical supply companies.
Okay, so they look legitimate on paper.
Exactly. They use these legitimate-looking fronts to file more than $10 billion in fraudulent claims to Medicare. And they do it using what they call straw owners.
Straw owners.
Yeah, individuals who are sent into the U.S., sometimes just on a tourist visa, for the sole purpose of setting up these sham companies. It keeps the overseas ringleaders' names off of everything.
Which sounds like a massive security failure that's basically weaponizing American identity theft.
It is. To commit fraud on that level, they need huge amounts of personal data. They use the stolen identities of more than 1 million Americans.
1 million people.
All 50 states. And this data was all bought and sold on the dark web, then used to bill for medical equipment that the victims, of course, never received and never needed.
And anti-fraud experts, the ones in the private sector, they're quick to point out why government systems are such a soft target.
Let me guess. Technology.
Yeah. Government agencies just lack the advanced tech that, a Citibank or an Amazon uses to spot weird payment patterns. Our tax dollars are left vulnerable because of basically bureaucratic inertia.
And these foreign criminals are more than happy to exploit that. And it filters all the way down to the local level. You see these con artists literally knocking on seniors' doors, offering something for free just to get a look at that Medicare card.
Deal the number.
Deal the number. You have to treat your Medicare ID like your Social Security number. You have to guard it carefully.
So authorities are finally trying to disrupt that structure. They're now actively capturing those straw owners, right? At borders and airports.
Yes, and the ultimate goal is to get the foreign ringleaders extradited back to the U.S. so they face what they call serious sentences in our courtrooms. They want to send a message that this risk will absolutely not pay off.
Okay, so that's the criminal fraud. But the problem goes deeper, doesn't it? It extends into just sheer waste at the state level.
Oh, absolutely. When we look at state-managed federal programs, we find just immense waste and abuse that is draining billions of federal taxpayer dollars, all because of lax state oversight.
And the sources point to specific states. Minnesota, for instance. It was struggling with what they called industrial-scale fraud because of poor state management.
The situation got so bad that authorities flagged 14 different Medicaid programs in Minnesota with significant ongoing fraud problems that were just, well, being ignored by the state.
So the feds had to step in.
The accountability was laid right at the feet of the state leadership. The CMS Administrator, that's the Centers for Medicare and Medicaid Services, she put Governor Walz publicly on notice. The statement said the state had committed a complete abdication of duties by just failing to act on repeated warnings.
So what did the federal government do when the state wouldn't clean up its own house?
They hit them where it hurts, the wallet. CMS started deferring payments, withholding federal funds, until the state could prove it was cleaning up its act.
So Minnesota had to use its own money to cover the gap.
Exactly. They were forced to cover the shortfalls from their own state reserves, their rainy day fund. It's a clear example of accountability. If you mismanage federal money, the state has to foot the bill.
Now, let's look at California. There we see a different kind of financial manipulation, right, inside the managed care system. Specifically, something called the Inland Empire Health Plan, or IEHP.
Right. This is a huge managed care plan, and it was charged with receiving at least a $320 million overpayment. And by law, they were obligated to return that money to the government.
Okay, so explain how that works. What is a managed care plan, and why would they have a surplus?
Sure. So a managed care plan gets paid a set rate, a capitation rate, per patient they cover. If they manage to provide care for significantly less than that amount, they're required by law to return that surplus to the federal and state governments.
So how in the world did IEHP hide a surplus of over $320 million?
Well, they basically manufactured costs to make the surplus disappear on paper. IEHP allegedly concealed it by, 1, creating sham incentive programs to funnel money to providers without a clear clinical reason, and 2, through illegal retroactive rate increases.
Retroactive.
Yes, payments backdated all the way to January 2014. They actively deceive state agencies to avoid returning hundreds of millions in taxpayer dollars they were just sitting on.
So the scale of this theft is just historic, but the good news here is that federal agencies are finally changing their strategy. They're moving from being reactive to being proactive.
The goal is simple, but it's really powerful. Stop the stolen taxpayer money from ever leaving the door.
And are they having success with that?
Immediate, tangible results. Authorities confirmed they successfully prevented over $100 million from leaving the agency just in the last few weeks because of these new measures.
$100 million in just a few weeks. How are they doing that?
A key strategy is what they call active pre-payment review. So right now, 27 providers are under this kind of review. And what that means for you, the taxpayer, is that the provider's money is held. It's frozen until their services are verified as legitimate.
So if the claim looks fishy, the money just doesn't go out.
Exactly.
Yeah.
That is prevention in action.
And central to all this is better technology and collaboration. The DOJ, the FBI, HHS, they're all finally breaking down those old information silos by creating this new healthcare data fusion center.
This is where the data science finally starts to catch up to the criminals. This fusion center, it aggregates all the data, payment data, provider behavior, geography, to instantly recognize suspicious patterns that they just missed before.
Can you give an example of that?
Sure. So they can now spot a sudden hockey stick spike in sales for one item, let's say fraudulent back braces, and see that it's all concentrated in one place, like Miami. That anomaly immediately flags an investigation, sometimes before the first fake payment is even processed.
And this is more than just basic filtering. They're deploying some really advanced techniques here.
Oh yeah, they are. Two powerful examples are global expenditure regression, or GER, and something called ICD coding subspace analysis.
Okay, break those down for us.
So GER is a method that flags providers who consistently bill way higher than expected for similar patients. It just finds the statistical outliers, the ones who are aggressively padding all their bills.
And the other one? ICD coding.
Subspace analysis. That's their main weapon against upcoding.
That's when they bill for a more expensive procedure than what they actually did.
Precisely. This analysis uses machine learning to detect those patterns. It tracks the frequency and combination of diagnostic codes to spot providers who are exaggerating how sick their patients are purely for financial gain.
And the results of this are promising.
The agencies report this data-driven approach gives them an 8-fold improvement in fraud detection rates compared to just random targeting. The tech is finally providing the hard defenses our tax dollars deserve.
So the scale of the fraud attack against our healthcare system was historic. It was fueled by organized crime and really enabled by these vulnerable, often backward government systems.
But federal agencies are finally deploying new technology and more aggressive prosecution to fight back and protect your funds.
The message has to be sent.
We have to send a clear, strong message that healthcare fraud won't pay off. And that requires prevention with these new data models and enforcement that actually delivers serious sentences. We can't have these criminals getting away with what amounts to a slap on the wrist.
And you, the American people, you are essential to this defense. Remember, over half of all whistleblower tips the government gets are about healthcare fraud. So guard your personal information, especially your Medicare number, and please report suspicious activity. The number to call is 1-800-HHS-PSS.
And to leave you with a final thought, while law enforcement is rightly focused on crushing this massive criminal fraud, their own data shows that roughly 25% of all program money is subject to just simple abuse and waste.
Money that's just not being used wisely.
Right. Routine government inefficiency. So the question remains this. If we successfully stop the $14 billion in criminal fraud, what steps must Washington take to stop the additional, far larger sums of money wasted every single year through simple inefficiency and misuse? That is the next battle for taxpayer accountability.